name is Adam Hawkridge. I'm a faculty member in the Department of Pharmaceutics here in the School of Pharmacy. My background is in chemistry, with an emphasis on analytical chemistry and biological mass spectrometry, interfacing with a lot of different investigators, basic scientists, clinicians to study the proteome as well as the human glycome. So the motivation for the kind of research that we do is one of pure discovery and the opportunity to discover something that can really impact health and disease outcomes. We are using this incredibly powerful technology. It's much like, I use the analogy of the Hubble telescope, to be able to really peer into biology in ways that traditionally have not been possible. And so we're able to discover, with the data that we're seeing coming off of these instruments in real time, all these data have a meaning, and it's a big puzzle. And when you have these really nice collaborations, you have experimental models, but you also have clinical samples, so you can really peer into health and disease in a way that is just amazing with the type of molecular specificity that you get with high-performance mass spectrometry. A number of, fortunately, funded projects that interface us with doctors in doing cystic fibrosis research, COPD, stem cell differentiation, and hemostasis, and those are collaborations that exist both here at VCU as well as throughout the country. In this lab space, as I said, we do cell culture. We have some of the types of standard equipment that you would need, like a centrifuge or plate readers, various things, but all of it at the end of the day, as we spend most of our time trying to do things extremely reproducibly, carefully, we're dealing with microscopic amounts of protein from valuable clinical samples that really you cannot go back and remake these samples. They've been provided to us to analyze as carefully as possible, and so we're looking at a few micrograms down to a nanogram of total protein to get thousands of protein identifications to look at what proteins are dysregulated, modified, changing as it relates to a disease phenotype. So this is the LC-MS system behind us. It is a nanoflow LC system, about 300 nanoliters a minute, not like the milliliters a minute that you might have seen as an undergraduate in instrumental analysis. With really large columns. These are very, very tiny fused silica capillaries, which are packed with stationary phase that we use to separate all these peptides and proteins and carbohydrates out, that then get ionized here at the electrospray ionization source, which is the home for, we're at the home of electrospray ionization at VCU with Dr. John Finn, the Nobel laureate. That then introduces ionized peptides and all sorts of biomolecules into the tandem mass spec, where these things can be analyzed with the combination of the quadrupole as well as the high-performance Orbitrap-based mass spectrometer that's behind me. So I've had a number of fantastic students. My first was actually a postdoc, Brad Mangrum. He joined the group at the very beginning. He's now at the FDA up in Maryland doing some really nice work. Emmanuel Cujo was my first graduate student to join the group. And he worked with a project with a collaborator at Massey Cancer Center on autophagy, published some nice work. We also did a side project on trauma, which was published recently. And then my most recent student, Zanira Hassan, who graduated about a year ago, she's now working for an instrument company, mass spec instrument company, and she did a lot of fantastic work on human microbiome as it relates to preterm birth. So my hack, is really in life and in science, is that persistence is what you need to have to really be successful. And I keep this picture of Babe Ruth at Yankee Stadium that says Babe Ruth struck out 1,330 times, and essentially I have this here in my office to remind myself that even the best of us strike out, but just keep swinging and eventually you'll connect. I want to terrify them. Yeah. That's what the haircut's
Exactly. Data swinging around, pushing buttons, lights are flashing.
You got to cut this stuff.
That's fine. That's fine.